Hello everyone. So yes, can you hear me so that we can start the session? Myself, Dr. Monalisa. So yes, this is the session of targeting FMG 2021 examination anatomy session 4. Okay, so myself, Dr. Monalisa, and uh, I will be discussing here 25 MCQs, which is important for your FMG session, December session 2021. So I have done my MD Anatomy from Armed Force Medical College, Pune. This is my code. ANAT10 is my code, which can be used by you for using as a referral code or by using as a code as an unlock code for seeing free sessions on the Unacademy platform. I also want to tell you that the features of special class. So what are the features of special class? It's an interactive live sessions where you can interact with the top educators of Unacademy platform. You can respond to a poll for a better understanding of a topic. Raise your hands and get your doubts cleared right itself in the live session. Okay, never miss a session. Get notified for the session of the upcoming course, and this will be highly beneficial for you. Also, I want to tell you about the lecture notes. So after completion of the session, you can download the PDF notes and you can get the lecture notes. Attend the session from anywhere, anytime, and be the part of live session. It is extremely beneficial. Use the code ANAT10 for getting 10% discount, and also use it as an unlock code as if you are seeing the free session for the first time. Now, plus course के क्या benefits है? So you can access both the live and recorded version. You can study from top educators of Unacademy platform, compete in live test quizzes. Coming soon is the printed notes coming with the Unacademy subscription. Access more than 25,000 MCQs and study on the device of your choice. So more than 25,000 MCQs are there on the Unacademy platform. So you can avail the opportunity of solving these MCQs. Also, what is the benefit of iconic subscription, where you get the benefits of live session of Unacademy and prep ladder? Both are integrated together, live integrated essentials, video lectures from the dream team. QBank 3 can be accessed, rapid revision, snapshots, and dream team notes of the prep ladder. So all these can be used by you. This will be highly beneficial for you. So go for iconic subscription, use the code ANAT10 to get 10% discount. Now, also updated highly effective QBank is there, in which there is 25,000 MCQs are there. There are 25,000 MCQs which can be accessed by you. You can use the code ANAT10 for getting discount, and this will be highly beneficial for you. So just go for it. Okay. And the explanation for each and every MCQs is provided by the best faculty of Unacademy platform. And I also want to tell you about the Neet PG Combat, where a scholarship of 1 crore rupees will be shared among the students. So tomorrow is the date, 10th October, 11 a.m. Do participate, 60 minutes, 45 MCQs. So up to 200 ranked students will definitely get you the subscription of Neet PG subscription. So just grab the opportunity, use the code ANAT10 to get enrolled for this session. I also want to tell you about the monthly free grand test for INICT 17th October, that is 2 p.m. to 5 p.m. and the session for the next session of the targeting the examination is the free test, which is targeting the FMG 2021 examination, 10 a.m. to 1 p.m. So two free test series are there. Those who are interested, so definitely use the code ANAT10 and get enrolled and be present for this session. I also want to congratulate the toppers from the Unacademy platform, Neet PG September 2021 toppers. All the best for their future. I'm very glad to share their picks with you. And the batch courses which is coming on, which is already started, is the Focus FMG batch, Mission INICT batch, Clinical Case Discussion batch, and Target Neet PG 2022 batch. Use this code ANAT10 and get 10% discount. Now, my dear aspirants, I also want to tell you about the Neet PG subscription. So if you are going to take the Neet PG subscription, I just want to show you the slide where the pricing detail of the Iconic and Plus is done. So this is the comparison of Iconic and Plus. Use the code ANAT10 if you want to take the subscription for 10% discount, and the students of first and second year should definitely go for 3 to 4 years of subscription. Other students of internship and final year can take 1 or 2 years of subscription. So my dear aspirants, let's start. So today there is 25 MCQs, okay? So all direct MCQs. So quickly we will solve the MCQs in another 50 minutes, okay? So 25 MCQs are there. So be present, participate in poll, and all the best. So which of the following is the most superior structure in the hilum of the left kidney? in the region of left lung, sorry, which of the following structure is the superior structure in the hilum of left lung? Sorry, left lung, whether it is pulmonary vein, whether it is pulmonary artery, bronchus or bronchial artery, which of the following is the most superior structure in the hilum of left lung? Left lung, okay, superior structure. So let me mark the correct answer. 4 options are there and you have to mark the correct answer. Okay, so I will just reduce the poll to 15 seconds. Now it was more of time, but I will reduce it. Okay. So yes, Samrik has solved it right. Samrik has given the right answer. So yes. So all those who are joining, so the correct answer is pulmonary artery. Let me show this diagram. Actually, this is showing the hilum area of right hand side and the left hand side. So what you can appreciate, the most superior structure, so is the hip arterial bronchus. Okay. Then lower to it is the pulmonary artery. Okay. Then lower to it is pulmonary vein, and the inferior most structure is the hyparterial bronchus. So see here, from above to down, the structures are eparterial bronchus, pulmonary artery, pulmonary vein. So what you can see, pulmonary vein is the inferior most. See here. So see the ratio, just a minute. So we have got third structure is the hyparterial, and the inferior pulmonary vein is the fourth structure. Okay. So these are the, and here in the left hand side, which was the MCQ question, here the superior most structure is pulmonary artery. Then we have got the bronchus. Okay. Then is the bronchus. So this is the first structure. This is the bronchus, and inferior pulmonary vein is the inferior most structure. So superior most structure in the left lung is the pulmonary artery, is the pulmonary artery. Due to division of the principal bronchus into hip and hyparterial on the right hand side, pulmonary artery is lying in between, and the inferior structure is pulmonary vein. So here the correct answer will be B. Let's move on to the next one. So this relation is clearly showing you all the structures from superior to inferior. Now question number 2. Which of the following structure is located in the posterior mediastinum? Lung, heart, azygous vein, superior vena cava, right coronary artery. So 5 options are there. Which of the following structure is located in the posterior mediastinum? Your time starts now. Okay, I have to reduce the timing. I just forgot it. Okay, I have to reduce the timing. So yes, the correct answer is azygous vein. The correct answer is azygous vein. So here azygous vein is lying in the posterior mediastinum. Lungs and heart. So lungs are laterally and heart is lying in the middle mediastinum along with great vessels, superior vena cava. Coronary arteries also are the parts draining into the heart only. So here if you will see the list of structure, posterior mediastinum is mainly containing thoracic aorta, thoracic duct, azygous vein, hemiazygous vein, esophagus, and thoracic sympathetic trunk. So these are the important structures which is lying in the posterior mediastinum. So please note down the entire list. These are all the structures lying in the posterior mediastinum. Okay. Now see here. Let's move on to the third MCQ. Which of the following is not contained in the, which is not contained in, which is, okay, which of the following is not contained in the anterior mediastinum? Okay, which of the following is not contained in the anterior mediastinum? So yes, mark the answer. I will reduce it into 15 seconds and mark the correct answer. Easy one. Okay, so yes, the correct answer is heart. Heart is lying in the middle mediastinum. It is not a content of heart is lying in the middle mediastinum. It is not the content of the anterior mediastinum. Rest all the structures are the contents of anterior mediastinum. Sternopericardial ligament, lymphatic vessels, internal thoracic vessels, and fat. So see here, anterior mediastinum. If we talk about the important contents which is residing in the anterior mediastinum, it's the fat, sternopericardial ligaments, the branches of internal thoracic artery, and lymphatic vessels. So definitely heart and its great vessels are the content of middle mediastinum. Now, intercostobrachial nerve communicates with which of the following nerve? Whether it is medial brachial cutaneous nerve, thoracodorsal nerve, long thoracic nerve, first intercostal nerves, or sympathetic trunk. 5 options are there. Mark the correct answer. Okay, so yes. Abhi has given the right answer. The correct answer is medial brachial cutaneous nerve. Medial cutaneous nerve of arm. So yes, intercostobrachial nerve is communicating with medial cutaneous nerve of arm, and that is definitely correct. That is medial brachial cutaneous nerve. So see here, actually intercostobrachial nerve is a branch from the second thoracic cutaneous nerve, which is forming a communication with that of medial cutaneous nerve of arm, and which is forming an important reason for pain in the medial aspect of arm. This is an important reason of pain in the medial aspect of arm. So we have got 4th correct answer, A as the correct answer. So is it okay? Let's move on to the next. That is question number 5. Which is not a branch? Which of the following is not a branch of aorta in the thorax? Which of the following is not a branch of aorta in the case of thorax region? Posterior intercostal, inferior phrenic artery, bronchial artery, esophageal artery, superior phrenic artery. So according to you, which is the correct answer? Your time begins now. 5 options are there and you have to give me the right answer. So yes, Harini has given absolutely right answer. Yes, actually inferior phrenic artery. Inferior phrenic artery is a branch of which important structure? Anyone? Please write the answer. Inferior phrenic artery is a branch of which of the following structure? Inferior phrenic artery. Inferior phrenic artery. Inferior phrenic artery is a branch of which of the following structure? It's a branch of abdominal aorta. It's a branch of abdominal aorta. What was the question asked? See here. The MCQ was which of the following is not a branch of aorta in the region of thorax? Okay. So inferior phrenic artery, yes, absolutely right, Pankaj. Inferior phrenic artery is a branch of abdominal aorta. Okay, abdominal aorta, you are absolutely right, not a branch of thoracic aorta. So यहाँ पे जो MCQ है, it is asking which of the following are the branches of thoracic aorta? Which of the following is branches of thoracic aorta? So here we have got inferior phrenic artery is a branch of abdominal aorta. So this is the correct answer. All other branches which is mentioned here, posterior intercostal, bronchial artery, esophageal artery, superior phrenic arteries, all these are the branches of descending thoracic aorta. All these are the branches of descending thoracic aorta, DTA. Now see here, branches of aorta in the thorax is posterior intercostal, superior phrenic, esophageal, and bronchial arteries. Got it? Now let's move on to question number 6. Which statement correctly applies to tricuspid valve? Which of the following statement is a correct statement of tricuspid valve? It guards the left atrioventricular orifice. It guards the conus arteriosus. It is also known as mitral valve, and caudate tendineae attaches to free edges of the cusp. So you just tell me which of the following statement is correct about tricuspid valve. Your time starts now. So yes, we have got Harini has given the right answer. Caudate tendinae is attached to free edge of the cusp is absolutely correct. So tricuspid valve is not mitral valve. Mitral valve is bicuspid valve. Okay. And yes, we know that it is not guarding conus arteriosus or it is guarding left arterio. Actually, it is guarding right atrioventricular orifice. It is guarding right atrioventricular orifice. So tricuspid valve guarding, and it is important for the unidirectional blood flow because of the presence of tricuspid valve in the atrioventricular orifice. Which one? Right. Base of the valve is attached to the fibrous ring around the orifice, and the coda tendineae is attached to the free edge. This was mentioned as the right answer for the MCQ. Yes, clearly it is mentioned that codae tendineae attaches to the free edge and the ventricular surfaces of anterior posterior septal cusp. See here. In this diagram, this thread-like structure, can you see here? This is the cusp of tricuspid valve, and this is the papillary muscle, which is also attached to the ventricular wall. This thread-like structure, which is shown here, is called as codae tendineae. So this is attached at the free edge of the tricuspid valve. So option B is absolutely correct. So you can see here, this is showing the codae tendineae of the tricuspid valve. So in this diagram, clearly you can see the codae tendineae of tricuspid valve. So we have got D as the correct answer. That it is the codae tendineae which is attached to the free edge of the cusp. So D is perfectly correct answer. Let's move on to the next one. That is question number 7. All the best, everyone. Parietal pleura is consists of all of the following parts except which of the following pleura is actually not a part of parietal pleura? It's the costal one, it's the pericardial one, it's the mediastinal one, it's the diaphragmatic one, it's the cervical one. 5 options are there and you have to give me the right answer. Okay, so yes, absolutely right. Pericardial is the correct answer. Actually, pericardial. So when we are talking about pericardial, so pericardial is absolutely correct answer. So yes, pericardial pleura is absolutely correct answer. Parietal pleura is consist of all parts except. So pericardial is not the part of parietal pleura. It is consist of costal pleura. It is consist of diaphragmatic, cervical, and mediastinal. So see here, parietal pleura parts is it is having costal aspect which is covering the interior of the thoracic cage, mediastinal, diaphragmatic lower down, and the cervical part, superior aspect. So cervical part which is also having the covering of, it covers the suprapleural membrane. So these are the 4 parts of the parietal pleura, but not the pericardial one. Actually, there is sternopericardial ligament which is attached with the heart. So and lying in the anterior mediastinum. So pericardial is B is the perfectly correct answer. Let's move on to the next. High death rate associated with the breast cancer. What will be the reason of very high death rate in the cases of breast cancer? It is related to nerve supply, whether it is related to blood supply, whether it is related to venous drainage, whether it is related to poor imaging techniques or the complex lymphatic drainage. So 5 options are there and you have to give me the right answer. High death rate is associated with breast cancer. What is the reason? So yes. Okay, so yes. So complex lymphatic drainage is absolutely correct. And the correct mode and the most common mode of metastasis which is taking place in the breast cancer is the lymphatic one. So E is absolutely correct. So because axillary lymph nodes are the most common site of metastasis from the breast, we have seen the various kind of axillary lymph node from the metastasis occurring in the most common pectoral region, the anterior one, and then also from the posterior aspect and central, and ultimately going towards the apical aspect. So palpable nodes in the case of women suggest the possibility of breast cancer, and this is one of the important points for the early diagnosis and detection of breast cancer. However, if there is an absence of axillary lymph node, there is no absolute guarantee that the metastasis of the breast cancer has not occurred. So for that, we have to examine. Actually, sometimes what happens, malignant cells may pass to the other nodes like infraclavicular, supraclavicular lymph nodes also. So generally, if there is any lump in the breast, so biopsy should be done and the lymph nodes should be examined, because the most common pathway for the metastatic cells to transmit is via the lymphatic drainage. So E is the most correct answer. Okay. Let's move on to the next MCQ. Okay, identify the arrow mark structure in the histological image, whether it is basket cells, stellate cells, Golgi cells, Parkanji cells. So can you see black arrow mark structure or the cell which is shown in this image? You have to identify this arrow mark structure. 4 options are there and mark the correct answer. So, okay, mixed bundle of answers are coming up. Okay, great. So here you can see this is the Parkanji cell. Actually, the correct answer is Parkanji cell. So this is flask shaped. Okay, this is flask shaped. As you can see, this is flask shaped cells. Okay, what? Okay, this is Parkanji cell. Actually, this is a slide of cerebellum. This is a slide of cerebellum, and in the slide of cerebellum, we have got 3 layers. We have got outer molecular layer, superficial layer. The middle is the Parkanji cell layer, and the inner is granular layer. The inner one is the granular layer. So here, I would like to show you the enlarged view of this Parkanji cells. These are all dendrites and all. So this is the enlarged view which you are seeing is of Parkanji cells. This is the nucleus, and this is all showing you the Parkanji cells. So this is the Parkanji cells, dendrites, and the cell bodies which is shown. Okay. So this is the granular layer, and the outermost layer will be the molecular. So 3 layers in case of cerebellum: molecular, Parkanji cells, and that of granular layer. And the most easily seen and the most important for identifying feature of the histology of cerebellum is the cells, is the Parkanji cells. You can see here. This is exactly showing you all the layers, the molecular layer, this small dots. So let me zoom it, the slide. This pink color structures which is seen here, can you see, which is in the form of one layer? This is Parkanji cell layer, and this dense structure is granular layer. The dense layer which you are seeing is the granular layer. So let's move on to the next one, question number 10. Left recurrent laryngeal nerve has got comparatively longer course due to persistence of which pharyngeal artery? So left recurrent, there is right and there is left recurrent laryngeal nerve. So you just tell me which is the reason of longer left recurrent laryngeal nerve. So yes. Okay, so 6th pharyngeal arch artery, 6th. So here you can see, I will explain you. So here you can see this is the arch of aorta developing, and here what happens? 1, 2, 3, 4, 5, 6. Okay, so here the 6th arch artery on this is right side, this is left side. On the left side, you can see it is forming ductus arteriosus. So it is not degenerating, it is forming ductus arteriosus, and in the adults, the ductus arteriosus form with structure. Anyone? In the adults, ductus arteriosus, which is forming connecting link between the trunk of pulmonary trunk and that of arch of aorta, is called as ligamentum arteriosum. It's called as ligamentum arteriosum. Absolutely right, Abhi. So what you can see, the arch of aorta is residing here, and the structure which is traversing and looping around is the ligamentum arteriosum, and the persistence of this structure, that is ligamentum arteriosum, is the reason that in place of left hand side sixth arch artery, that the longer duration is longer course is of left recurrent laryngeal nerve. So yes, absolutely right. So this is the reason that the question number 10, the correct answer is option D, sixth. Let's move on to the next, that is question number 11. All the best to everyone. Nerve supply of the muscle shown in the diagram. Which muscle is shown in the diagram? Firstly, try to identify the muscle and then tell me the nerve supply, whether it is suprascapular, dorsal scapular, subscapular, or dorsal rami of C1 nerve. So according to you, which is the correct answer? Question number 11, mark the correct answer. Your time starts now. All those who have joined just now also, they can give the correct answer. So your time starts now. Okay, so yes, we have got the correct answer as dorsal scapular nerve. So yes, absolutely right. Then can you tell me which muscle is this? Can you tell me which muscle is this? Question mark. Which muscle is this? This green, which muscle is there? Absolutely right. Levator scapulae. This muscle is levator scapulae. Yes, Harini, this muscle is levator scapulae. And the hint is that it is attached onto the superior border of the superior angle and going towards the medial aspect, medial border of the scapula. So levator scapulae hai, uske niche rhomboides minor and major hai. So its nerve supply is dorsal scapular nerve. Now see here. Here we can clearly appreciate the muscle which is arising from the transverse process of C1, C2, C3 and 4 and attaching to the superior aspect of the medial border and superior angle. Next to it, the muscle is rhomboides minor. Next to it, the muscle is rhomboides major. Next to it, the muscle is rhomboides major. So you can see here, these are the muscle which is located here in succession. You can see here. This is the rhomboides minor, and the major. Minor is above, major is below. And if we talk about, so this is clearly showing you that these all muscles are attached to the medial border. Most superior is the levator scapulae, and its nerve supply is by dorsal scapular nerve. Can you tell me dorsal scapular nerve is a branch of which part of brachial plexus? Can anybody tell me dorsal scapular nerve is a branch of which part of brachial plexus? Dorsal scapular nerve is a branch of which part of brachial plexus? Anyone? Yes, Abhi is absolutely right. It's a branch of root, and basically it is having the root value C5. C5 is the root value. Okay. Now, ligation of common hepatic artery will lead to the compromising of blood flow in which of the following artery? कौन सा artery ligate हुआ है? Common hepatic artery. So, which artery blood flow is affected? Whether it is right and the left gastric artery, whether it is right gastric and short gastric artery, right gastroepiploic artery and short gastric artery, right gastric artery and right gastroepiploic artery. According to you, which is the correct answer? So question number 12, mark the correct answer. Okay, so yes, we have got 29% students has given the right answer. Harini is leading, followed by Abhi, Pankaj. Okay, so absolutely right. The correct answer is right gastric artery and right gastroepiploic artery. Why this is the answer, I will tell you. Because actually common hepatic artery is giving two important direct branches. One is the right gastric artery and the other important branch, actually common hepatic artery is giving a branch gastroduodenal artery. Okay, gastroduodenal artery is giving right gastroepiploic artery, and right gastric artery is a branch from common hepatic artery or hepatic artery proper. Hepatic artery proper. So let me show you the important branches. Celiac trunk is there. So what are the direct branches? The direct branch of celiac trunk is left gastric artery, splenic artery is the second direct branch, and common hepatic artery is the third direct branch. So see here, 1, 2, and 3. So what is there? Left gastric artery, splenic artery, and common hepatic artery. These are the three direct branches of celiac trunk. Other than that, if you will see, a branch from common hepatic artery is gastroduodenal artery, which is again dividing into two important branches. One is right gastroepiploic artery, another is superior pancreatico-duodenal artery. One is right gastroepiploic artery, another is superior pancreatico-duodenal artery. So these are the branches from gastroduodenal artery. These are the branches from gastroduodenal artery. So in terms of ligation of common hepatic artery, the right gastric artery branch from common hepatic artery or hepatic artery proper, and right gastroepiploic artery, which is a branch of gastroduodenal artery, which is again a branch of hepatic artery, is the right answer. Let's move on to question number 13. A 56-year-old man comes to the hospital with abdominal pain, jaundice, loss of appetite and weight loss. उसके बाद क्या होता है? On examination and doing the radiograph and the CT scan, the physician finds a growing tumor in the uncinate process of the pancreas. Which of the following is the most likely to be compressed? Whether it is splenic artery, whether it is portal vein, whether it is superior mesenteric artery, whether it is superior pancreatico-duodenal artery. So 4 options are there, and you just tell me the correct answer. So, okay, so yes. So the correct answer is superior mesenteric artery. Actually, superior mesenteric artery, superior mesenteric vessels are lying in close relation with the uncinate process of the pancreas. For that, I would like to show you the diagram. So see here, this is the head and this is the uncinate process. This is the uncinate process, and uncinate process is related with superior mesenteric vessel. Clearly in this diagram, you can see this is the uncinate process. Uncinate process is having the relation of important vessel, that is superior mesenteric vessel. So in this case, the correct answer and the relation will be of superior mesenteric artery. Superior mesenteric artery. Done? Okay, let's move on to the next MCQ. MCQ number 14. A man is brought to the emergency department after meeting with an accident and injured perineum. He feels an urge to micturate, but he is unable to pass the urine. There is blood at the tip of the meatus with excessive swelling of the penis and the scrotum. What is the possible site of injury? Penile urethra, bulbar urethra, membranous, or urinary bladder? So yes, we have got approximately 63% students are correct. So Harini is leading, followed by Abhi, Pankaj, great. So the correct answer is bulbar urethra. The correct answer is bulbar urethra. Okay. So the key point here is that he feels an urge to micturate but unable to pass the urine, and the blood is at the meatus and excessive swelling. This is most important point, that swelling is in the scrotum and penis. And we know that there are two important injuries which is common in the urethra. One is the membranous and the other is bulbar. In case of bulbar urethra, the extravasation of the fluid and the blood will be surrounding the penis and scrotum and can lie in the superficial perineal pouch and can extend to anterior abdominal wall. But in case of membranous urethra, the the collection of the blood is on the deeper aspect. So B is absolutely correct answer. So you can see the parts of urethra. You can see this is the prostatic urethra around the covered by the prostate, membranous urethra which is lying in urogenital diaphragm. Then comes the bulbar urethra, and this is the penile urethra. So this is exactly the area which is injured. Now in this diagram you can see here, when there is injury of the bulbar urethra, the urine is accumulated in the superficial perineal pouch. Means after the injury of bulbar urethra, the blood has to accumulate inferior to that of this rupturing, and it will go into the area in between the inferior layer of the urogenital diaphragm and Colles fascia. So it will go into superficial perineal pouch in the scrotum penis, and anteriorly and in the upper aspect it can ascend up to the lower aspect of anterior abdominal wall, but it will not go towards the deep perineal pouch. It will not enter upward direction the deep perineal pouch. So this is the correct answer. Metacarpophalangeal joint is which type of joint? Condylar joint, saddle joint, hinge joint, ellipsoid joint. Metacarpophalangeal joint is which type of joint? Condylar, saddle, hinge or ellipsoid joint? Question number 15, mark the correct answer. According to you, the best answer is okay. So mixed bundle of answers are coming. Okay, so yes, we have got Harini leading with Abhi. So the correct answer is ellipsoid. Actually, you can get doubt that both condylar and ellipsoid is correct. So many books has written both condylar and ellipsoid, but I will go with ellipsoid type of joint. Why? Because functionally it is an example of ellipsoid joint. So metacarpophalangeal joint. Okay. AD confused. Okay, condylar. Yeah, Pankaj, condylar. You please not mark it. Condylar will be the right answer if we go with the structural classification, but functionally it is ellipsoid, and the better option is to go for ellipsoid type of joint. So D is perfectly the correct answer. Now, reticular fibers of collagen tissue is present in all of the following except which of the following lymphoid structure is not containing reticular fibers of collagen tissue? Thymus, bone marrow, spleen, and the lymph node. What is the correct answer? Question number 16, mark the correct answer. Okay, the correct answer is thymus. So my dear aspirants, please note down. Okay, please note down, this is very important. Actually, thymus is a lymphoid structure. Thymus is a lymphoid structure which is devoid of reticular fibers. So we know that in case of lymphoid structure, the support or the connective tissue framework is formed by reticular fibers. So in case of thymus gland, we have got epithelio-reticular cells. We have got epithelio-reticular cells. Absolutely right, Harni. Epithelio-reticular cells, which is giving the support, not the reticular fibers, which is giving support to spleen, lymph node, and the bone marrow. So A is perfectly correct answer. Now, dense irregular connective tissue is found in which of the following? Dermis, lamina propria, tendon, and ligament. Dense irregular connective tissue is found in dermis, lamina propria, tendons, and ligament. According to you, which is the perfectly right answer? Question number 17, mark the answer. Okay, so yes, we have got so great. Pankaj has given the right answer. Pankaj has given the right answer. So yes, yeah, absolutely right, Pankaj. Dermis is the correct answer. Actually, when you will see, dermis is a layer of the skin, and in this case, the arrangement is dense irregular connective tissue. So in case of dermis, there is dense irregular connective tissues arrangement. When you are talking about regular arrangement of connective tissue, agar hum baat kare regular arrangement of connective tissues ki, the regular arrangement of connective tissue, it is found in the case of tendons, it is found in the case of, yes, ligaments, it is found in the case of aponeurosis. Lamina propria means loose connective tissue. It is not dense, it is loose connective tissue. So which is the correct answer? A is correct answer. Let's move on to question number 18. Hard palate. What is this? Hard palate contains which of the following epithelium and histology? So which of the following? 4 options are there about the histology of hard palate. You just tell me which of the following is correct. Whether it is keratinized mucosa, absent submucosal layer, minor salivary gland, keratinized mucosa, submucosal layer, the minor salivary gland, non-keratinized mucosa, submucosal layer, minor salivary gland, non-keratinized mucosa, absent submucosal layer, or minor salivary gland. So we have got 4 answers, 4 options, and we have to choose one. Okay, so yes, we have got 25% of the students has given the right answer. Hard palate contains keratinized mucosa, submucosal layer, and minor salivary gland. So my dear aspirants, B is absolutely correct answer. B is absolutely correct answer. So it was asked in the Neet PG examination last year, and please note down that it contains the keratinized mucosa along with salivary glands and some mucosal layer. So B is the correct answer. Now, all of the following arteries of the pelvis are branches of internal iliac artery except. Okay, so this is easy one. Mark the correct answer. Whether it is umbilical, uterine, ovarian, or vaginal. So according to you, which artery in the list provided is not a branch of internal iliac artery? Your time starts now, and we have got following options, and we have to mark the right answer. Oh, what a good. So yes, many of the students, okay, so many students has given the right answer. Many students has given the. Okay, dear. Okay, Harini. Harini is leading it. Okay. So yes, Kundan has told that, ma'am, I always get confused between the keratinized and non-keratinized. So yes, ovarian artery is the correct answer. Yes, Kundan, I'm coming to your point. Don't worry. Ovarian artery, actually gonadal arteries, gonads, whether it is male gonads or female gonads. Okay. Ovarian or testicular artery, they are direct branch of abdominal aortas. They are direct branch of abdominal aortas, and rest branches, that is umbilical, uterine, and vaginal arteries, are the branches of anterior division of, these are the branches of anterior division of internal iliac artery. Okay, yes, Kundan, so don't worry, there is a list. Actually, skin jo hai, so if you are talking about keratinized, Kundan, please note down, skin is an example of keratinized epithelium, keratinized stratified squamous epithelium. And filiform papilla of tongue, filiform papilla of tongue is having keratinization. Tongue is having non-keratinized epithelium, but filiform papilla is an example of keratinized epithelium. Also, hard palate is an example of keratinization. So jahan bhi skin area aa jayega, uske paas keratinization hoga. Rest all many examples are there non-keratinization, which is very close to the skin. Okay, Kundan, you can see my class of epithelium. Search special free session of epithelium and just go through all example of epithelium. That is very important question for histology. Let's move on to question number 20. So before that, see the branches. So important branches of internal iliac arteries are, so anterior division ka obliterated umbilical artery, superior vesical artery, obturator artery, vaginal artery, inferior vesical, the uterine artery, the artery to ductus deferens, middle rectal, internal pudendal. My dear aspirants, inferior gluteal artery also 3. So all these tick marks which I have shown you is the branches of anterior division. Only 3 branches from posterior division, that is superior gluteal, lateral sacral, and iliolumbar. These are the three branches. Sill, superior gluteal, iliolumbar, lateral sacral. These are the three branches from posterior division of internal iliac artery. Ovarian artery is a branch, as you can see, directly from abdominal aorta. So all of you will take the PDF notes and you can see important branches of the abdominal aorta. Superior mesenteric, celiac trunk, inferior mesenteric are ventral branches, lumbar arteries are lateral branches, gonadal artery, renal artery, and iliac arteries are terminal along with median sacral. So do revise the branches of abdominal aorta. So many diagrams I have took. Inferior phrenic artery is also a branch of abdominal aorta. Just now we have discussed. Now, which of the following structure extends into labia majora? Whether it is suspensory ligament of ovary. So, is it okay, Kundan? I have given your answer. Is it okay, Kundan? Okay. Ligament of ovary proper, processus vaginalis, round ligament of uterus. Okay, mixed bundle of answers are coming up. Okay, so yes, the correct answer is round ligament of uterus, which will extend till labia majora. I would like to show you the diagram for it. Okay, so see, my dear aspirants, you can see here from the lateral aspect of the uterus, this cord-like structure, which is which is a content of inguinal canal traversing through deep inguinal ring and coming out through the superficial inguinal ring, traversing through inguinal canal will reach till the level of labia majora. So rectosigmoid, it was a direct only. Rectosigmoid junction lies anterior to which of the following location? Rectosigmoid junction is lying anterior to prostrate, S3 sacral vertebra, obturator foramen, or urinary bladder. My dear aspirant, 4 options are there. Mark the correct answer. Rectosigmoid junction lies anterior to. Mixed bundle of answers are coming up. 33% students has given the right answer. Let me see the leaderboard. Okay, many of the students has joined late. So Harini, Abhi, great performance. Some students have joined late. So S3 vertebra is absolutely right answer. S3 vertebra. The third sacral vertebra is absolutely right answer, dear. Yes, those students who have joined late also, don't worry. They can see the session and they can revise all the MCQs from the very beginning. So my dear aspirant, this is the rectosigmoid junction corresponding to S3. It is corresponding to the S3 or the third sacral vertebra as shown in the diagram. Okay, so my dear aspirants, let's move on to the question number 22. Urogenital diaphragm is contributed by all of the following except 4 options are there, whether it is sphincter urethra, perineal body, Colles fascia, or perineal membrane. So according to you, which is the structure which is not contributing in the urogenital diaphragm formation? 4 options are there. You have to mark the correct answer. Okay, so 78% students has given the right answer and the correct answer is Colles fascia. So my dear students, how you are going to memorize it's correct. Urogenital diaphragm, I'm writing in short form. It is consists of 2 muscles. One is sphincter urethrae and the other is deep transverse perineal muscles. Okay, now these 2 muscle is covered by superior and inferior layer of urogenital diaphragm. So one is superior layer and the other is inferior layer of urogenital diaphragm. Now, inferior layer of urogenital diaphragm is called perineal membrane, and superior layer is there. Colles fascia is forming the boundary of superficial perineal pouch, so it is not having any correlation with urogenital diaphragm. Rest all the structures which is mentioned in this option is forming connection with the urogenital diaphragm, but not the Colles fascia. यहाँ पे आप देख सकते हैं very nicely, you can see here. This is urogenital diaphragm, and this is contained in the deep perineal space. Superiorly, it is having urogenital diaphragm. Superior layer is there. Inferiorly is the inferior fascia of urogenital diaphragm. Inferior fascia of urogenital diaphragm is called the perineal membrane, and lower down you can see Colles fascia. Actually, Colles fascia is a continuation of Scarpa fascia of the abdomen, and this whole space which is lying inferior to urogenital diaphragm is the superficial perineal pouch. So clearly we can see Colles fascia is not contributing to urogenital diaphragm. Colles fascia is not contributing to the formation of urogenital diaphragm. Now, I also want to show you this structure. This is the perineal body where many of the important muscles are converging here. Okay, so here many muscles are converging. This is urogenital. This is called as the perineal membrane. Okay, this is the perineal membrane, and what you can see, the muscles converging is superficial transverse perineal muscle, the deep transverse perineal muscle, levator ani, external anal sphincter, the bulbospongiosus muscle. My dear aspirant, many times this MCQ has been asked that which muscle is not contributing to the perineal membrane. The answer is ischiocavernosus. Can you see this is lying laterally? Ischiocavernosus is not contributing. Rest all muscle is interlacing at the perineal body. Other than that, sphincter ani muscle, and also longitudinal muscle coat of rectum and anal canal. Longitudinal muscle coat of rectum and anal canal. All these muscles are interlacing at perineal body. Let's move on to question number 23. Which muscle is correctly matched with the accompanying description? So morphological relation, you have to match the following. Which is the correct match the following? Lumbricals 1 and 2 bipinnate. Lumbricals 3 and 4 unipinnate. Dorsal introsia is bipinnate. Palmar introsia is bipinnate. Deltoid is bipinnate. So these are the combinations. You have to mark the correct. You have to select the right combination. So yes, we have a 33%. So actually, dorsal introsia bipinnate is perfectly the correct combination of the morphological muscle fibers and examples. Rest all are wrong. So I will show you that diagram so that you can understand. See here, in this diagram, what you are seeing is this is the bipinnate. Okay, this is also bipinnate. This is unipinnate, and this is also unipinnate. Okay, so here, my dear, this is first, this is second, this is third, and this is fourth. So third and fourth, as you can see in the diagram, is bipinnate. So third and fourth lumbrical muscle, this small earthworm like muscle which is arising from. So lumbrical muscle are arising from FDP tendon. So third and fourth are bipinnate. First and second muscle is an example of unipinnate. So I am talking about which group of muscle? Lumbrical muscle. What is lumbrical muscle? Earthworm like small muscle which is arising from the tendon of flexor digitorum profundus. Okay. So very nicely you can appreciate third, fourth is bipinnate, first and second is unipinnate. So we have got this as wrong. Lumbrical first and second, unipinnate. Lumbrical third and fourth, bipinnate. So A and B is wrong. Now coming to palmar introsia. So see here, you can clear, if I zoom it also, you can see very clearly see that palmar introsia. Again, this is the palmar introsia, and what is the shape? You can see in the diagram. The shape is unipinnate. Again, the shape of palmar introsia is unipinnate. Got it? Now coming to the next one, let's zoom out. This is the dorsal one. So this is the Okay, this is the dorsal introccei, and the dorsal introccei muscle. When we are talking about dorsal introccei muscle, this is bipinnate. As you can see here, this is the example of bipinnate morphological muscle. Okay, very nicely. So here you can see clearly. Now you can say this is the correct option. Dorsal is bipinnate. Are you connecting to the diagram? Let me know. And here you can see the wrong is palmar introccei. Now deltoid is multipinnate. I will show you the diagram, my dear. Deltoid is multipinnate. See the diagram of deltoid. So here you can see this is the deltoid muscle. So many feathers are there. So many feathers. So this is what? This is multipinnate. So deltoid के acromial fibers क्या हो गया? Many feathers. So deltoid acromial fibers of the deltoid muscle is an example of multipinnate. It's an example of multipinnate muscle fibers. Okay. Now, innervation of short head of biceps femoris is provided by which of the following nerve? Whether it is obturator, femoral, tibial division of sciatic, or the fibular division of sciatic. Okay, absolutely right. Yes. So actually, this biceps femoris muscle is again an example of hybrid or composite muscle. And the reason is that why it is an example of hybrid or composite muscle, it is having two heads when we are talking about long head. So my dear aspirants, please note down, when we are talking about long head, it's getting innervation from tibial component of sciatic nerve. And when we are talking about short head, it is getting innervation from common peroneal component of sciatic nerve. So D is the correct answer. It's an example of hybrid muscle. Now, a line drawn from ASIS. What is ASIS? Anterior superior iliac spine to the ischial tuberosity is called as Nilatin's line. So it is passing over the lateral aspect of the hip, and it passes over which of the following structure? Whether it is sciatic nerve, whether it is ischial spine, whether it is obturator canal or the greater trochanter. So yes, we are having 50% students are correct, and the correct answer is greater trochanter. Actually, this is used in the previous times, okay, for showing any kind of dysplasia, injury of greater trochanter or neck of femur. So these were the clinical tests which was performed, and this Nilatin's line will be passing over the lateral aspect of greater trochanter. So see here, line connecting. Here you can see this is ASIS, anterior superior iliac spine of the hip bone. And this is the ischial tuberosity of a bone. And if we connect it with an oblique line, so in a non-displaced and uninjured hip joint, the femur and the hip bone, we will this line will pass superior aspect of GT. What is GT? Greater trochanter. What is GT? Greater trochanter. My dear aspirants, so I will again come up maybe for 3 or 4 days. I will be not able to take the special session, or maybe 1 or 2 I will take, but I will take a continuous special free sessions for you, in which many MCQs we will solve it together, so that you can crack your exam with a better score, and I will try my level best so I can be useful for you. So all the best, keep studying. Thank you so much. We will again meet with the new session. Is it okay, everyone? So all the new students can join my session by using the code ANATEN. Thank you so much. All the best. Keep studying. Any doubt, anything, you can ask me in the group. Okay, any doubt related to anatomy, any suggestions or anything you want to study from me, you just post in the group. Okay, the link of all the sessions will be provided in the Telegram group. Let's crack Neet PG. Okay, all the best. Thank you. Thank you, students. Thank you. We'll update you about all the timetable and schedule. Thank you so much. Thank you, students.